Still trying to figure out how to make this thing work. Hey, Tom. Not very good with this technology stuff. All right. So, let's see, is that Amy? All right, guys. For my Thursday thoughts this week, I got a question from a DPT student, Amy DePelto. I had to ask her how to say her last name, so thanks for giving me that, Amy. But Amy wanted to know if I'd mind doing a periscope on how I assess core stability and strength with my patients. So we're going to go through a few standardized tests that I use every now and then, but to be honest, I don't usually use them. I'm just throwing these out there for her as a DPT student. So first test I usually use is I'll use leg lowering. So I'll start, this is a picture from my CrossFit Journal article on, what was that one on? The hips and athletic performance. So I'll start, athlete has both their legs vertical in the air. In this instance, we actually used a rubber band under the low back so that if she started to lose her lumbar spine positioning, the band would move and she would know. It was a good way for us to do a self-assessment. If I'm in the clinic, I just stick my hands underneath the back to feel when they start to go into a little bit of lumbar extension. But her legs started vertical, and then she lowered her legs down as far as she could while maintaining her low back flat. This one's good a lot of times when you have some higher level athletes that think they have a really strong core, but you kind of know that they're not. It's one of those things you can use to prove to them that maybe they're not as strong as they are. Another test I'll sometimes use is the trunk stability push-up that's in the FMS. For that one, you have athletes lay down on their stomach, almost in a push-up position. For girls, especially athletes, I like to start with their thumb. I think it's at nose level. For males, thumb at forehead, something like that. Don't quote me exactly. But then you ask them to do a push-up, and it's really good insight into, do they keep their lumbar spine in a good position while they're doing a push-up? So over here, you see between the start of the movement and her getting into the push-up, she keeps her lumbar spine pretty flat and neutral, versus if somebody starts to drop into a little lumbar extension, you know they have a little bit of core instability or strength deficit that's preventing them from being able to activate the core for anti-extension. Those two I rarely pull out. This again, sometimes just for some high-level athletes, I'll use that. This one maybe more discharge testing, or if somebody, like a gymnast comes in with an extension intolerant back as our retest between visits for how she's doing, or he. One that I do like to do regularly is looking at active straight leg raise versus passive straight leg raise. So if they're doing an active straight leg raise and they're not, instinctively activating their core muscles, then they're going to go into a little bit of lumbar extension as they raise their leg up. That's going to tilt the pelvis a little anteriorly, and a lot of times you'll find in that case that their active motion during a straight leg raise would be a lot less than their passive range of motion. I think in the SFMA they talk about like a 10 degrees difference between those two would be indicative of a core instability problem. And again, don't quote me on those numbers. I just use these as gross tests. I'm not somebody that sits and pulls rollers out and measures specifically. I tend to believe that being a little bit more general works well for me rather than getting specific and goniometering everything. But those are three that I use sometimes, but more often I like to be specific to that patient and what sport they play. And this is a great quote from Mitch Babcock, DPT student who's going to be doing a rotation with me. And me and Mitch actually connected after he posted this on his Twitter. If you go to a provider and they don't watch you do the activity that irritates you, you're in the wrong place. And basically that was really close, that I believe very strongly in. If somebody's coming to you for an athletic injury, you better look at them doing something that very closely resembles what their sport is. So if they're a weightlifter, you better be looking at them squat or bench press or even cleaning or snatching if you have that option in the gym. Because if you don't look at that, these tests a lot of athletes can pass. They might have really strong abs when they're actually sitting there and thinking about doing that double leg lowering, and they're consciously trying to keep their abs straight. But when you go to do a squat or a handstand or something like that, they might do something very different. So you got to look at the for. And this is a good example. Again, this is from my CrossFit Journal article, the hips and core, or the hips and athletic performance is what it's called. You see here, we're starting with a little bit of lumbar extension. So I'm not starting in the most neutral lumbar position. As I go down, again, my lumbar spine there's in a little extension, so I eventually get to where that anterior pelvic tilt blocks me from going any further, and I'm going to go into that little bit of butt wink lumbar flexion as a result of it. I'm big on looking at the hip hinge just for somebody's general movement pattern and how they stabilize the core as they go into a hip hinge pattern. I've written about that a lot on my website. You can also look at something like a handstand for a gymnast or a CrossFitter is going to provide a huge amount of insight into what they do with their core. You can't assume that just because on the right this girl has her lumbar spine in extension that she has a weak core. It could be that she has such crappy shoulder flexion or shoulder elevation that she's having to substitute down the chain. So I wrote in an article for CrossFit Journal, Analyzing the Handstand Position was the name of the article, kind of a breakout on how you can use the handstand to analyze somebody's wrist, shoulder, mobility, thoracic spine and lumbar spine, stability, hip extension. Another big factor that you want to think about if you're going to test somebody's core stability is what happens with fatigue. Greg Glassman, the creator of CrossFit, gave a really good article years ago that I discussed in one of the hips article we mentioned earlier, where he looks at the push press as a way to analyze somebody's hip dominance versus quad dominance. And he actually suggested that they do a 20 rep max push press, because what he was saying was that in people that are very quad dominant, they might be able to do a couple reps of a push press where they're keeping their low back in a good position, where they're loading their hips up. But if they're a really quad dominant athlete with weak hips and weak core, they're going to default more to what we see over here on the left, where she started to let her low back round, her pelvis is really posteriorly tilting, and she's just shooting her knees forward to really load the quads. Versus on the right, she keeps lumbar spine stable when she's doing the push press. She's loading her quads, but she's also loading her hips by kind of sitting that butt back a little bit. And for those of you that don't know what a push press is, it's basically a overhead shoulder press where you go into a little bit of a dip, just about as much as you see right here, just a little bit of a knee bend to get a little leg momentum to start that movement. So those are a couple of the tests that I use. More than anything, it's really looking at the movement that the athlete performs is what's most important to me if I want to analyze somebody's core stability. Again, those other tests are good if you want to put some numbers down on it or to show somebody that thinks that they're really strong that maybe they're not as strong as they think they are. There's only a couple people live right now. If anybody has any questions, put them up here in the next few seconds or I'm going to log out. All right, guys. Well, thanks for joining me, Amy. I hope that helps. And I will upload this to YouTube and my website as well. Functionality of sit-ups. As far as a test or an exercise, I do CrossFit, so I need to be able to do sit-ups because it's something that's going to come up in my workout. Do I ever prescribe it to people? No, because I don't see a big point in doing it. Unless you're just specifically trying to stabilize, work the abs. I think there are plenty of other exercises that are going to be a lot more challenging and better work the abdominals than sit-ups. Yeah, I'm not like the super anti-repeated flexion like the McGill camp is, but I do think that they bother a lot of people's backs, and we should probably more carefully prescribe those when we're in the fitness world. But I also don't believe that we should tell people to never do them. if I have somebody that's got a history of disc herniation problems, then I will probably suggest other core exercises for them. But otherwise, I'm just going to tell them to keep a varied abdominal exercise program in place and not just focus solely on sit-ups. Anything else? All right, guys. Well, I hope y'all have a great Thursday, great weekend. Go Panthers. Super Bowl 50. Take care, guys.